If this bridge, made famous by a Nordic noir TV crime thriller, seems quieter than usual, it's because it now divides rather than unites neighbours. On one side, Denmark, which has closed its borders, while on the other side, Sweden, bucking the European trend in its response to the coronavirus pandemic by remaining open for business. In this street in Stockholm, there's not much evidence of social distancing, and the shops are open, even though the official advice is to stay at home and work there. Primary schools are open as well, with officials claiming that children aren't major transmitters of the virus and that otherwise somebody else has to look after them. Cafes and restaurants are open too. This was one in the Swedish capital this morning. Though nobody wanted to talk about why they were there, many Swedes are relieved to have avoided lockdown.
I think it's good for the economy that we try to keep it as open as possible. And I'm not sure if we do have the right strategy or not, but maybe the other countries are not doing it the correct way.
At the hospital with the biggest intensive care unit for those infected, the doctors say they are not overwhelmed. There have been 59 deaths reported in the last 24 hours, and there's a constant hunt for ventilators, with this one 25 years old. But Sweden is putting its faith in this man, Anders Tegnell, its chief epidemiologist, and now a household name, who says the restrictions, such as they are working.
This level of measures that we have in Sweden, there is no problem for us to keep it running for months. Closing schools, more stringent measures like that, closing borders. You cannot do that for months or years ahead. But what we're doing in Sweden, we can continue to do for a long time. And I think that's going to prove to be very, very important in the long run.
A new opinion poll suggests that Swedes support this light-touch regulation in a country wedded to consensus politics, where people say they trust state experts. Though Cecilia Söderberg Nauclair, an immunologist, is one of over 2,000 scientists who've signed a petition urging the government to take more action so the health system can cope.
We are scientists, we don't trust authorities, we trust data, and we don't see the data that supports that we should go for this strategy as the only country in the world. And when you get into an overload in the healthcare system, you don't have a choice to close down. You will have to close down then, and it would have been better to do that earlier so we can keep this in a controlled situation.
But from Sweden's Interior Minister, talking to us from the back of his car, no apology that his country is taking a different path.
I think the most important thing here is to get people to actually follow recommendation, think for themselves, to understand what the risks are by social interaction with people. So if people understand and follow that kind of regulation and recommendation, I think we have the same results as other countries do as well.
The Swedish army is building this new overflow hospital in a suburb of Stockholm, much as the UK and others have done already. But for now, this is a country which looks pretty much like the UK did before restrictions were imposed last week. And if the upward curve of cases defies predictions, Sweden may be forced to change tack as well.